There's nothing worse than to be dealing with chronic aches and pains and know everybody that you talk to has a different idea of how to solve it. Are you with me on that? I know for me, when I used to deal with chronic aches and pains on a regular basis, everybody that I knew had an opinion, whether they were healthcare professionals or not. And they would give me all this information, and I'm trying to apply all those things only to find out that I was just frustrated because I couldn't stop the pain. And then I figured it out. Welcome back to the Muscle Repair Shop. My name is Butch Phelps. I'm a functional massage therapist, and today I want to talk about the frustration of chronic pain. I see people every day come into my practice that are dealing with back pains and neck pain, shoulder pain, knee pain, hip pain, foot pain, and they've gone to this person and that person, and their Uncle Bob told them something, and Aunt Emily told them something, and another friend told them something. And their head is just all messed up because they've had so much input on what should work, and yet nothing does. And over a period of time, they start to not trust anything that anybody says. And then when somebody does come along that gives them some good advice, they're so mixed up, they start to substitute what people who were in the wrong told them into the place where people who told them that was in the right. It's frustrating for you. It's frustrating for me as a therapist because you can see the things that are happening, and at the same time you start to realize that the person has heard so many different ideas that they're totally confused at this point. That confusion will cause more stress in your body and cause more pain from your chronic aches and pains. How do you like that for a great idea? So anyway, today I want to talk about some of the things that I see people being told to do, watch it come back on them and actually cause them more aches and pains, because even from professionals you can get training from them that can screw things up for you if you're not careful about that. So one of the major ones that I always see is low back pain, and for most of you, I'm sure if I could see you and you could raise your hands, you'd probably all pretty much raise your hands that at some point in your life you've had low back pain. And so the thing to understand is that whenever we are being trained in any healthcare schools, whether it's massage therapy, physical therapy, physician, trainer, whatever the case may be, our jobs, we've been taught to literally stop the pain, but not so much find the cause. Now, when you go into someone, and again, we're going to start with low back pain, for instance. You go into someone with low back pain, whether it's a massage therapist, a physical therapist, a doctor, or whatever, their first inclination is to start working and looking at your back because they will assume that you have a back problem. And one of the things that I've learned in the last 20, 25 years of my business is that rarely is that the case. So I had a gentleman the other day who was having some back pain, and I've been working with him, trying to get him to stretch out the front of his quads, his inner thighs, to stop that so he could start standing up straight. He was a little bit older, and then he started going to other practitioners who started giving him exercises to do. Now, from the other practitioner's standpoint, what they were looking at was the back needed to be strengthened. And so I want to show you one of the things that I see almost every day, that I see so many therapists and trainers recommend to their clients and patients when they have back pain. And I'm here to tell you, if you have low back pain and the pain increases when you stand up after sitting for a while, getting up out of bed, or if you stand for a while, your back starts to tighten up. If you don't know it, let me be the first one to tell you that this particular move I'm going to show you will make it worse. And I've seen it over 100 times in my career. It will make it worse. And I'm going to explain once I get into that position why. So you've heard of people talking about a bridge, doing a bridge. So doing a bridge, you see, you're laying on your back like this, and you're going to lift your hips up off the bed. Now, for me to lift the weight of my hips, which is what I'm lifting here, I've got to tighten my quadriceps, my hip flexors, and my abdominal muscles, but I also have to squeeze my hips to really push it up like this. So if these muscles are tight, so that when I stand up, for instance, and these are short, so when I try to stand up straight, my back hurts, then what's going to happen there is the muscles in my hips are going to get tighter, and so that back pain is going to get worse. And I can't tell you how many times I've seen people pay good money to get that advice for their back pain. Recently, I saw someone who was given an exercise where they would lay on their stomach like this, put their hands behind them like that, and lift their head and their feet up, tightening their hips, hamstring, and low back. Again, if you've got back pain and you have pain where you sit, or you have pain when you stand, that exercise is going to make it worse. The reason you have back pain, plain and simple, is not that your back is weak. In most cases, rarely is that the case. Most of the time, your low back pain is going to come from the front of your thighs and your inner thighs, or your hamstrings if the pain hurts you when you sit down. So that's the thing to keep in mind, that so many of these exercises that people have you to do are really kind of detrimental, because they're coming from a place where they think you are weak, when all it is that you're actually just tight. So if you like this information, please share it with your friends. Be sure to ring the bell and subscribe to this channel. And for now, see ya.